We're in a very concerning situation in the UK where after importing a highly transmissible, more severe variant associated with significant vaccine escape, we've seen this spread rapidly into our communities. Data shows that in the regions where this variant first became dominant, the spread has been among school-age children first and then spreading into the community. We've seen this again and again. And very sadly, now we're in a situation where cases among school-age children are the highest and rising very rapidly. So the government on the 17th of May made a decision to remove recommendations of masks from schools. At this point in time, the government claimed that it was following the data, not the dates. This was challenged by independent SAGE, numerous experts, and went against the advice even of SAGE at the time. So in May, the citizens sent a pre-action letter to the government asking for the data requested by unions on the number of Delta variant cases in educational settings to be released. Citizens alleged that Public Health England suppressing the data at the behest of number 10, which was reported by the Observer, constituted unlawful suppression of data due to surrendering independent judgment by Public Health England. Unfortunately, this data hasn't been released to date. In the middle of a pandemic, we critically rely on public health organizations to be independent in the advice that they provide and the transparency in the data that they release. If there is government interference in this, that is really concerning because that can actively put people at risk, can also make it harder for people to understand policy, fueling public distrust, but also make it hard to hold government to account or scrutinize policy when government is getting it wrong.